Dr. Rosensweet, welcome back.
Hello, Shemaine. Good to see you.
It's so good to see you again. We were just having a little chit chat there, just talking about slowing down a bit and getting ready for the long weekend. And sometimes it's hard to slow down, especially in the health industry. Wouldn't you agree?
Well, I think it's been a half of a lifetime practice for me to get present. And it's a daily practice. And I can get off and go into my head or go into worry. But if I can catch myself, I can show up in the present moment. So it isn't so much the world. It's more like what's going on in my own self and my own ability to get present.
Yeah.
Yeah.
On our last conversation a few weeks ago, you remember we were speaking about in those moments of high upset and anger and rage, being able to take a step back and maybe even leave the room and just go inside and recognize, like, why am I feeling this way? Why am I reacting this way? So since you brought that up, I've been trying to do it more actively and looking, as cliche as it sounds, more internally for my peace and my happiness, and also being more realistic with my expectations of myself, because I don't know if it's the same for men, but definitely for women, we can put extreme expectations on ourselves, and then we start to talk negatively to ourselves and feel like a failure and I'm not doing good enough. And some I'm highly ambitious, so some of my expectations are extreme. So since we last spoke, I've been really trying to talk to my inner child, maybe.
Yeah, right on. And the expectation part, that's a study in itself because it really it really implies that you're judging yourself,
Yep.
as we all do. This is not unique to you. Now, and that judgment can be negative. It can be, well, you're not enough, or you didn't do that fabulous enough, or you should have done that much better. Well, where's that energy coming from?
Mhm.
It's ancient. It's come through the human race universally, and it's that part of ourselves that hasn't grown so much that we see the total truth of life, love, and the universe and the divine.
Mhm.
And because we're not conscious of that fully enough, we're scared and we think there's something wrong with us. Because there is, in a certain sense, if we're not feeling love, if we're not aware of the biggest picture of all, then we're nervous. And so the general concept is shame. There's something wrong with me. So if you're judging yourself, there's a judgment in there, there's something wrong with me. Well, there's nothing intrinsically bad about that. It's at the frontier of your spiritual growth. Oh, I'm identifying, I'm feeling shame right now. So what's the medicine? Well, you get conscious. I'm feeling shame, but not so much with the concept. I'm feeling shame with the feeling of shame, and you breathe and you feel it, and you become aware of it emotionally. So you feel it and you accept it. You allow it to be the energy that it is, and there you are, Shemaine. Am I pronouncing your name right,
Yeah,
Shemaine?
perfect.
There you are. You're sitting there in the moment doing a podcast and simultaneously multitasking, and I'm not saying this is going on for you right now, feeling shame. And you're breathing and feeling. And that what's happening there is you're doing an act of acceptance of who I am.
Mhm.
Even the parts that are hurting, that need to grow, that need to get you're learning the act of unconditional love, and you're learning it through unconditionally loving and accepting yourself in the moment with the shame. That's the challenge. When you're feeling shame, we tend to want to go, oh, that's bad. I got to get rid of that. I got to heal that. No, the only thing that heals it is acceptance, an act of unconditional love.
Mhm.
So it's all grist for the mill, as has been said.
Mhm.
And so it's all honorable. And it's all part of what we're here to do. This is the great work. We're talking menopause, we're talking hormones, we're talking cancer. But the great work for all of us is healing emotionally and thus mentally and in our physical body.
It's a huge juggling act. It's not just the exercise, the nutrition, the hormones, it's the spiritual health, it's the emotional health, it's the excess baggage, it's the self-talk, it's everything. You're trying to balance everything. And I generally don't talk too negatively to myself, but I'd mentioned to my group last week that I found myself talking down to myself. I was making myself feel bad purposely, and I had to stop and, like you said, look in the mirror, and I had to come to this realization that no, one, back to the hormones. I was in my PMS season, so we've got the hormones playing against me. I was also tired. I also was dealing with some IBS issues. And instead of just telling myself, well, you should have done better. Why did you do that? You shouldn't have done that. I became a bit more realistic and introspective and was like, no, it's okay. You've been dealing with a lot lately. You're doing your best. Let's just keep moving forward. But that was new to me as well. I've had a lot of new things since talking to you the last time because I'm very much like many other women, just go, 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 go. And not that I try to push away the shame or the fear. It's just I'm too busy to give it time, basically.
Yeah, a couple things there. Women have been judged for a certain, what has been called frailty monthly, whereas some cultures recognize that when a woman went into that degree of sensitivity once a month, that that was critical for the whole tribe. And they used to have menstrual quarters where the menstruating women would gather together with other women and live with them for a day or two and be relieved of all household chores
I wish.
because the tribal leaders came to realize that the women had such an intense degree of sensitivity that things could be seen and felt that ordinarily couldn't be seen and felt.
Mm.
And so, for example, once a day is what I heard, the story as I heard it, the tribal elders would come into the women's quarters, menstruating quarters, and say, what's up today? And women would say, well, you know that adolescent boy, George, out there? He looks like he's doing okay, but he's not. He's slipping off the rails. He's going to get a little wild here if he doesn't get some help. Put some elders on him. The women were able to pick up things that or other people weren't seeing.
So intuition was enhanced.
The sensitivity was enhanced on every level, the emotional sensitivity, the consciousness sensitivity. And then menopause is like perimenopause and menopause is like the royal version of it. It's let's pause midlife and identify what really matters here.
Mm.
So you could say, "Oh God, I was menstrual," or it was it all got amplified by menopause or perimenopause, and that's bad. And I'd say, well, no, life is constructed that way.
Mm.
It's important at midlife to examine everything, and you're thrown into a level of sensitivity where you can't take the usual upsets, where people being harsh to you, for example,
Mm.
rough to you, impolite to you. Ordinarily, you take it, you'd shrug it off, but you can't right now, midlife.
Yeah.
That's good. That's good for you to realize, for an example, okay, I'm going to talk to my spouse. I'm going to say, I've come to identify that you speak to me in a certain way. I'm not saying this is what's going on in your life. I'm just giving you an example. You're speaking to me in a harsh, emotional way, and I'd like you to examine that because you don't need to do that. I'm your best friend in the world, type of thing. So it's like once a month, women are given increased sensitivity, and midlife, that sensitivity is amplified for you to examine everything and basically ask the question, what really matters here? What
With
is,
Sorry, with regards to that though, how come it is that some women are more sensitive and they're more emotional and weepy? Is that where their hormones might be a bit more elevated or fluctuating more than the woman next to her who is still sensitive but not as sensitive?
well, I think every individual needs to be understood for the individual that they are. So you'd have to give me an individual case. This world has downplayed the importance of emotions. So when I hear the case of an emotional woman, where I start with is, my God, she's been able to preserve her emotions even up to this point in her life and not suppress them and not control them.
Mm.
I hold it as a sign of health in general. That doesn't mean her agitation also isn't coming from really rough stuff happening in her life.
Mm.
But we'd have to look at the individual woman and the individual situation. We're all different in that way.
Yeah.
Women are different from one another, but you always look at it's one of the most important principles in health and healing is look at the individual because we have a lot of differences. And to be successful in healing, we want to pay attention to the individual circumstances. You could have a woman who's getting over emotional. For the first time in her life, her genuine emotions are becoming more authentic.
She's allowing herself to feel and let them out at last. That would make sense.
Precisely.
Yeah.
And in allowing them to arise will illuminate her consciousness as to why that's happening and what there is to do about it.
Do you think,
Whereas another woman might have never really done the emotional core work she needed to do. And it's exploding out and getting her in trouble. She's making communications that are excessive. She's blaming others that she should really be focusing on herself. My favorite cliche in that regard is I want to put my attention on the splinter in your eye rather than the telephone pole in my own.
mm, yeah, that's a good one. So what you're saying is maybe we should come up with some menstrual rooms again, maybe menstrual hotels where women can go for a few days and just do the inner work that they need to do.
Well, that would be ideal. And but you can also, once your skill level increases, you'll be able to integrate it into your daily life better,
Yeah, yeah,
which would be in this day and age probably more practical.
yeah.
I mean, I'm all for a once a month retreat. My God, men and women, we all could use
Yeah,
that.
I think it might be a good business plan. I'm pretty sure if you had
Yeah,
a menstrual hotel, you wouldn't be short of clients.
a menstrual spa.
Yeah. So,
Well, and that's what the tribal, the stories I heard about is this women's quarters, the menstrual quarters, all the needs of the women were taken care of. They didn't have to cook, they didn't have to gather food. Their needs were taken care of because the tribal elders wanted to give them the space to use their clairvoyance,
yeah.
to use their sensitivity rather than be all caught up in daily activities.
So now we're all caught up in the daily activities, and it's almost like a pot that's about to boil over. We're not getting the release because we're trying, and everything's just bubbling to the surface, and then women explode and they lose their temper at the kids and husband, or they're crying in their bedroom. I don't know what's wrong with me. Um, it would make sense. And I wonder as well, apart from societal expectations. I wonder, we've been hearing so much about perimenopause, menopause, hormone, a lot of talk now, and I think a lot of people seem to think it's new. This is all new, and it's just getting worse because of society and how we live nowadays, and maybe that is an aspect. But what it sounds like you're saying is this has been happening for thousands of years. We're only hearing about it more now because we have podcasts, we have social media, we have more voices that we can hear.
And also, I think what you mentioned, that there is something new about it in human history. Human consciousness has remained so primitive that we're in jeopardy in losing the whole Earth, the whole planet. And we should be rattling in our cages more than ever before because the need for disruption, the need for inspection and change is super high right now.
Mhm.
And there's a lot of reasons for it, but maybe we are shook up more, and maybe we are influenced by a lot of factors that have never been part of human life. The unconsciousness developed toxicities. The unconsciousness poisoned the food supply in the air and the water. There's hormone disruptors galore out there, and they are definitely playing a role. So it's a complex issue. Where does an individual address it?
Yeah, it's true.
Acquire more skills, knowledge, and support about your own emotions, because they're the key. That's where the energy is.
Yeah.
And as you get more skills, one thing you'll learn to do is respect the emotions as they're coming up. And you'll have the tools to deal with them elegantly. So right now, you have no idea if I'm feeling absolute terror or if I feel happy
Hmm.
because I could be hiding it. Because even if an uncomfortable feeling were able to come up for me, I could recognize it. I could give it what it needs to be felt. And I could carry on my conversation with you as if I wasn't feeling fear.
Hmm.
I don't know if that's too complex,
No.
but the level of skill you can acquire to feel your own emotions and be a safe space for them taking place inside of your own being, that's one of the skills that's needed
Hmm.
to become awake to say, well, what am I feeling right now? Oh my God, it's shame. It's fear. Okay, I'm going to breathe and feel. That's the only technique. The technique is not that more complex.
Yeah.
Because if you allow it to be the energy that it is, even if it's shame, you don't try and get rid of it or suppress it or heal it or get busy so you don't have to feel it. You just are conscious of it and you feel it. You're actually doing one of the most profound actions that there is. You're accepting it.
Hmm.
You're allowing it to be the energy that it is. That's an act of unconditional love. You're training yourself in unconditional love. And that's what we need. We need a lot of, we really need to expand our ability to love ourselves, to accept ourselves, and then we'll be able to bring that to the world.
Mm. It's interesting. I've heard of some other very successful people and entrepreneurs, especially in the business space, discuss um, using that darkness, which would be, I suppose, a simplified term for the rage, the upset, the shame, the feeling, using that darkness to fuel their success, instead of sitting with it and thinking with it, just allowing the anger and the worry and the upset to fuel them, keep them focused, keep them grinding, for lack of a better word, just keep them going. So, not dealing with it, but throwing it on the fire, just keep it going.
I like that. It's a step forward. They have become aware of darkness.
Mhm.
That's a great leap forward. And they're talking about integrating it. Don't get rid of it. Don't judge it. Use it.
Yeah.
Use that energy.
Mhm.
Now, I think there's a refinement of that where the judgment is removed because it isn't darkness. That's a general term. Emotionally, it always comes down to fear or sadness or anger or shame or guilt or hopelessness or powerlessness.
Mm.
Always, that's what's inside of darkness. And it's those core feelings that need to be seen, felt, and accepted. So another model would be, oh my God, I'm feeling darkness. Well, wait a minute. What do I feel when I feel darkness? Oh my God, God, I'm feeling fear. I'm feeling shame. So the next step is to let it be the energy that it is. It's like if a 10-year-old girl ran into the room that you're in right now, screaming at the top of her lungs, obviously feeling terror. You wouldn't want to say to her, stop it. Go into your bedroom. Don't come back to talk to me until you've gotten rid of this crap. Girls don't feel like this. Women can't live like this.
Mhm.
That'd be one choice. Another choice would be, come here, sweetheart. Sit in my lap. I'm going to hold you. I'm going to go quiet. You're having a lot of feelings. That's beautiful. You keep screaming. You keep crying. It's valid.
Mhm.
That would help her heal.
Yeah.
She'd cry and scream. She was giving permission and acceptance. And that would allow her to feel her feelings and give her feelings what they need, loving acceptance, because
And
they're
be
valid.
she's also heard as well. A lot of people don't want to be
Exactly. But
heard
she's
now.
being accepted. The word heard could be translated as she's being accepted for exactly what's going on for her in that moment. That'll heal. That screaming will stop. And then you can talk to her about it. What were you fearful about, honey? And there's more to it. There's belief systems and stuff. But the human race is stopped cold, except for those pioneers who are really taking this one on. The human race is stopped cold by not allowing the feelings to come up and dealing with them in a safe way. They project it. It's my spouse, it's my partner, it's the Chinese, it's the Americans, it's the Republicans, it's the Democrats. It's projecting it out as if there's an enemy outside. That's got us at the threat of extinction on this planet. It's lack of taking personal responsibility for our own pain. So
And
this is the great work. It's taking personal responsibility for our own pain and not holding it as darkness so much, although I think that's an advance of what those people are suggesting. But hold it as, what is this? Yes, this person is being mean to me, but what do I feel? I feel shame. I'm not going to react. I'm not going to punch him in the face. I'm not going to tell them to shut up. I'm not going to try and change them because it's hard enough to change myself. But what I can do is I can realize that they're screaming at me and I'm feeling shame. Okay, what does shame need? Loving acceptance. I'm going to breathe and feel the shame. So this would get more real if I were to actually walk you through that. And here we are in this podcast doing all this stuff, which is always an honor and a delight for me.
oh,
But it gets more real when you get guided into it. Like if there was a moment you were feeling shame and I helped walk you into it
well,
to feel it,
I'm feeling pretty good this morning. Had you
that's
spoken to
great.
me last week, then I would have needed your help. Maybe I should have emailed you. But you're saying there's a lot of people doing this work now, helping the more emotional mindset, addressing the darkness, the psychologists, therapists. I don't envy those people at all. It's a very tough job. I would much rather be doing what I'm doing, the physical, the biological the more material aspect, because I have clients who are psychologists, they are therapists, they are counselors, and they're not in a good place because they take on all that energy. It's a hard, hard job to help others with their mental and emotional health.
A lot of therapists have chosen that field I have a family member that chose that field to become a therapist. And when I heard from that family member that they were going to become a therapist, I said to myself, better they should go into therapy. This person needs the therapy rather than to become a therapist. But a lot of people in emotional therapy work have gotten themselves there because they've been on that healing path themselves. And it's been so valuable to them. And they've seen the magic in it that they're genuinely wanting to assist others with it.
Yeah.
So, an army of therapists is what's needed at this point,
Mm.
and God bless them. And if they're skilled at it, they can do so much good.
Yeah, they definitely have big hearts. They care, but then I always get concerned that they end up taking home other people's
Well,
energy
that's part of the skill. I mean, why would they take that home?
because they're not trained properly.
It's complex. They would think that they're not a good person, or they're not a good therapist because they couldn't help that person, and they got triggered by the pain of their client. They themselves were listening to the story of the suffering of their client, and they started suffering.
Mm.
What that client did for them is uncap and unveil suffering that the therapist hadn't healed yet. And in a way, when you're skilled, that's a gift. You're in a session with someone, and this happened to me once. You're in a session with someone, you're objectively listening to their story, and all of a sudden I start feeling tremendous fear. I got triggered
Mhm.
by their story.
Yeah.
And at the time, I had the skills to respect that. And I said to myself, boy, tonight when I get home, I'm going to remember this and go back to it because I got some work to do on the fear that I got triggered.
Mhm.
And I did. And it was a gift to me to get triggered because I got to work with some stored fear that I wasn't aware that was there. It's complex, but the beautiful thing is the deeper you get into it, the more both people get healed. The therapist heals their weakness around boundaries, so to speak, where they're picking up and getting affected by the suffering of someone else. But if you've moved out of the land of suffering, basically, into the more real of who you are and what the world is, you can listen with compassion and open heart, which they're very good at,
Mhm.
and acceptance, because you've accepted your own suffering.
Mhm.
So you don't take it on as a therapist. You're listening with compassion, non-judgment, because you've made it through that particular bardo, so to speak, in your own self. So you don't take on their suffering. In fact, you're very compassionate and understanding about it because you yourself walk through that fire
Yeah.
inside of your own being. A little bit of complex topics we've gotten in here today, Charmaine.
I know. We do got to circle back to the hormones as much as it was fascinating.
However you'd like to do it. I like to go where you like to go. So, however you like to do it.
Well, on our last conversation, one of the kind of light bulb aha moments was around estriol or estriol, however you pronounce it, um, and that being our more protective estrogen, and in higher levels in younger females, that's why we don't see breast cancer, for example, in younger women because they've higher levels of estriol. Can we just kind of start off there again? Because right now there's a lot of conversation around estrogen in general.
Yeah. Well, at the core of that discussion is cancer.
Mhm.
That word estriol comes up because of its relationship to possibly being protective against breast cancer. So it's a very important subject. But I like to start out with the basic information about breast cancer itself and how does it develop? Or more important, how does cancer develop?
Mhm.
And our genetic heritage for most everyone in this lifetime, not everyone, but most everyone, our genetic heritage is health. We're designed to be healthy and heal, to move into a state of vulnerability to any illness, including cancer. A lot of things have got to go not too well. So when we look at someone with breast cancer or prostate cancer or any cancer, let's say we had a video of their whole life from the moment they were in the womb, they were conceived,
Mhm.
till this very day. There was a videographer filming everything 24/7.
Mhm.
Then the videographer pressed a button on the video recording and it got rid of all the good stuff, all the fun, all the love, all the good food, all the exercise, all the good stuff that we know is good for everybody.
Mhm.
What would remain is most of the story of how that person got ill. Oh, look at that. They're eating a Twinkie. They're eating some sugar there. Oh, look at this. They're going a whole year of eating too much sugar. Oh, look at this. They're having all kind, their emotional repressed content is arising and they're not doing anything about it. They're just triggering the internal stress response, or they're doing an addictive thing like overworking or drugs or whatever, alcohol. We would see in a video the causes of an illness so profound as cancer. Those are where the causes are.
Mhm.
Estrogens aren't a cause, but what the healthiest situation looks, so I want to put it in perspective. You've got the humongous thing around what causes cancer, the bazillions of little micro events. I got a little uptight with my partner. It's their fault.
Yeah,
No, that's very stressful to yourself, your body, your immune system, and it's inaccurate. They did not cause your pain.
they did not
Worst
cause your
case
cancer.
scenario, they could be off the worst case scenario, they could be off the rails and inappropriate, but you could go, gee, honey, how's your day going for you? Seeming a little harsh and exaggerating around me. Let's, if you don't want to deal with it yourself, take a little break here. And what I'm saying is that there's these micro events that diminish the immune power, that everything that goes into health creation gets affected adversely. That's what the cause of cancer is.
Yeah.
Now let's look at the hormones. The hormones are about normal, healthy, vital function, including of the immune system. And what I love to say is really what a dear friend and colleague and a pioneer in this work said, just copy nature. Nature's got this really well set up. So that doctor, Dr. Jonathan Wright, did that in the 1980s. He was looking at hormones. He said, why don't we just copy nature and prescribe to women in menopause, for example, the estrogens that they had when they were young?
Mhm.
And what he saw was research that showed what the three major estrogens were and what their young, healthy balance was. And there was more estriol than there was the sum of the other two estrogens were the more potent ones,
Mhm.
estrone and estradiol. He saw that as natural. And
Mhm.
he ran across research in which a medical doctor and oncologist was examining the urine and hormones of women with breast cancer, and he saw something very different. He saw much less estriol. So Dr. Wright proposed, listen, when we're treating women in perimenopause and menopause, why don't we just copy nature? Radical thinking.
It is now, yeah.
And give them more estriol than they have estradiol and estrone because that's how nature's designed it. Almost 20 years later, the research came out on that there's two major estrogen receptor sites. Oops, look at that. And they function differently.
That's the
And one of
beta
them,
and the alpha, am I correct?
that's right.
Yeah.
And the receptor site alpha, when it interacts with hormones, It stimulates. It causes proliferation. It causes the renewal of the endometrial lining, rather thick, to receive a possible egg that's fertilized. It also causes every single month preparation for breastfeeding right away. New breast glandular cells developed by cell division, by mitosis. And that's the proliferative phase.
Mhm.
And if there's no implantation, the whole woman's cycle goes into a deproliferative phase. The breast cells disappear. The endometrial lining gets so weak that it eventually sloughs and a woman menstruates. And that's deproliferation. That's what we want in menopausal women. We don't want proliferation of breast glandular tissue in menopausal women.
Mhm.
And it was learned that the principal stimulant of alpha was estradiol, the most potent estrogen that comes out of the ovary. The principal stimulant of estrogen receptor site beta, the deproliferative, was estriol.
Mhm.
So it turns out if you copy nature, you're really respecting the estriol, the deproliferation, which is we want to emphasize anyway. So to the extent that we can protect ourselves from cancer biologically, we want to copy nature because nature's got it all set up.
Mhm. And use more
And you use more estriol.
yeah. So because estradiol is so proliferative, if there was already some sort of weakened immune system or metabolic dysfunction there, someone has a bad diet, lifestyle, if there was potentially already some sort of underlying cancer risk, then too much estradiol could encourage the proliferation of that if it's not contrasted with estriol, triol.
That is the common conception. But I'd like to challenge that conception. Where it gets practical is when a woman has a breast cancer, that cancer is analyzed
Mm-hmm.
and it's classified. Is it estrogen receptor site positive or is it estrogen receptor site negative? Implying if it's estrogen receptor site positive, that if you give that woman estradiol, you're going to increase the cancer growth. Not true. This is where it gets really wild and really intricate.
Mm-hmm.
That as one famous expert, Dr. Avram Blooming, an oncologist who specialized in breast cancer, has pointed out that when you do surgical excision of any breast cancer, it's a tumor. And when you analyze it, it's got all kinds of cells in there. It's got healthy looking breast cells, or relatively healthy looking breast cells that you can identify as breast cells. And it's got undifferentiated cells that you can't even tell that they came from the breast. That's the cancer. The problem is not the estrogen receptor site. It's the undifferentiated cancer cells that don't respond to anything. So it's controversial. Dr. Blooming did some work in which he treated women who had breast cancer and had the breast cancer properly treated with hormones. And he's written about this. And he couldn't tell the difference. Estrogen receptor site positive or negative, it didn't seem to make a difference who got the recurrence. So it's not scientifically clear at all that if a woman has an estrogen receptor site positive cancer, that if you give her estrogen, you're going to increase her risk. Not true. So it takes me back to what in the heck causes cancer? Does
Everything.
estrogen cause cancer? No. If you have a cancer, are you going to make it grow a lot faster by giving a woman estrogen? If she has an estrogen positive receptor site, very blurry in there.
Mm.
Best case scenario is when you come to Earth, take on as part of what you want to learn how to be healthy and how to heal and do a lot of good stuff
If a
I
woman,
know I'm getting pretty off the charts there, but I want to make it blurry because the whole information around estrogen receptor sites is very confusing because no one can make hide or hair of it except Dr. Blooming assures it. Like here's the science. What we know about women and hormones is that women who are treated in menopause with hormones have a less risk for breast cancer than women who are untreated in general.
part of that, I would argue, is, well, two things: helping manage the stress response. I firmly believe stress is a huge factor in cancer, probably one of the biggest, and I think you might agree. And then the second things is the hormone therapy can help also with blood sugar and insulin regulation as well. And I'm definitely not blaming sugar for cancer. I'm not one of those people. I think there's multiple causes of cancer, not just one. But that, in my opinion, would be partially where hormone therapy helps with the cancer because of those two aspects at least.
Those and more. Estrogen supports the immune system, for example. Women who had good estrogen levels were much less susceptible to raging consequences of COVID, for example, because their immune systems were stronger. But let me take it one step further. Women who have had breast cancer and had that breast cancer properly treated, they have an increased risk of recurrence than a woman has for developing cancer who's never had it. However, if that woman who's had breast cancer and had that breast cancer properly treated is treated with hormones after the cancer treatment, her chance of recurrence is lessened. The hormones reduce her chance of recurrence.
If we have
So that's irrespective of receptor sites. It doesn't matter. Estrogen positive receptor sites, estrogen never negative receptor sites, no matter what, that woman has a lessened risk for reoccurrence of that cancer if she's treated with hormones and if she's not.
That kind of answers my next question. But if we have a woman who, for example, over 200 pounds, has a lot of endocrine exposure externally, so her body is toxic, she's got the excess body fat, doesn't live the best lifestyle, and now she gets diagnosed with, we'll just say, estrogen positive breast cancer. Would the approach not be then to give her estriol triol to offset the estradiol in our body, which is also coming from the fat cells, which would be toxic from heavy metals, endocrine disruptors, whatnot?
Technical. You know how to get down into the weeds there. Well,
Because
there's
in
a
that
paper
case,
out that we've been looking at recently where there was fat biopsies done on women in menopause. And what they discovered was there was way less progesterone, and there was an increased ratio of estrogen to progesterone. And it was challenged that this itself wasn't a problem. There was too much estrogen, and especially in someone with more fat cells,
mhm.
when they have more estrogen.
And is that primarily estradiol in those fat
Well,
cells,
I think I'm not sure, but I think more of it's estrone, a storage. Uh,
which gets easier converted into
you can
estradiol?
convert it to estradiol. But in that study, what wasn't revealed, well, what's a young woman's fat biopsy look like? Is the same thing true of a young woman? Now, that's not answering your question. I realize
But I would guess probably not.
a 200-pound woman or a 200-pound man is more vulnerable for a lot of reasons. Is like, how did they get there? And what have they got going on metabolically that would get them overweight to that extent? And there's a lot of health issues in there. So I'm not answering your question. In fact, I totally forgot what the original question
But
was.
would we not just treat because they're more
Oh, I see. Well,
estradiol
let's
dominant?
look at it this way. You have a given patient who's overweight, come to a physician or a nurse practitioner in menopause. They've got hot flashes, they got night sweats. Why don't they just rely on their own body fat?
I would argue because, well,
There ain't enough.
it's
There's
either
not enough
sequestered,
estrogen.
yeah,
Pardon?
it's either sequestered in the tissues and the fat cells and they can't get it out to utilize it, or as our good friend Carol would say, back to your point, they don't have any progesterone.
Well, yeah, Carol Peterson, a wonderful resource. Um, Really is a world expert on progesterone, and there's a real place for not enough progesterone. You betcha. Oh my God. Can't think of a woman on the planet who wouldn't benefit by more progesterone her whole life. Well, for one thing, I've been specializing in menopause for 33 years, and it's very unusual for a very significantly overweight woman to come to me. And so one of the things I'm not familiar with is what is the clinical situation with a 200-pound woman
Mm.
in menopause. And as expert as I am in many aspects of menopause, I'm not in overweight because they don't see very many of them.
Would that
And
be
it's been my
because?
theory
Yeah.
that what the very thing you're talking about, the estrogen in their adipose tissue being converted, made in their adipose tissue is sufficient. But it's only been a guess and it's only been a theory.
Yeah.
But I do see overweight women. They come to me, they're 5 years into, I'll give you an example. They're 5 years into menopause, they're overweight. In fact, weight is one of their concerns. They're having hot flashes, they're waking up in the middle of the night. If I give them progesterone, it doesn't do it. I need to give them estrogen for them to be able to sleep, for them to be able to not wake up in the middle of the night with a night sweat and a hot flash and stay awake for a couple hours. In other words, whatever we may think is in their fat cells, by replenishing additional estrogen, it alleviates these estrogen deficiency symptoms. It's inadequate. What's in their fat cells alone, and progesterone alone isn't going to do it for them.
It
So
makes
it's an interesting theory, but in actual practice, try and tell these women who are overweight, who can't sleep at night, that we should deprive them of estrogen because there's enough in your fat cells. No way.
yeah.
So does that make practical
No, it
sense to
does.
you?
I get it. I do get it. It makes a lot of sense because this is something I've been delving deep into for a few weeks in reg especially estrogen in regards to blood sugar regulation and blood sugar, as we spoke about in our last conversation, blood sugars, insulin resistance, they are a factor in hot flashes and night sweats. So maybe it is the case that giving them extra estrogen is improving the insulin sensitivity, and that's inadvertently helping with the hot flashes and the night sweats. So it seems like, back to what we were saying, every woman is individual. Some women are experiencing hot flashes and night sweats because of their stress response and adrenaline, and those women do very well with the progesterone. But maybe other women don't because their issue is more blood sugar dysregulation and the estrogen is helping with that for them. Am I explaining that right?
Second opinion, sleep disturbance of one type or another is one of the most common symptoms of a woman in menopause. And there's a hormonal basis for it in most of these women. And in some women, until you restore their progesterone, they're not going to get to sleep. And that's, in fact, that's one of the more common complaints. I can't fall asleep. And I've even got anxiety. That's a progesterone deficiency type of sleep disturbance. Not exclusively, but it's really a good way to categorize it. Other women, they're waking up in the middle of the night, they got a hot flash, or they don't have a hot flash, but they can't go back to sleep. They've got a racing mind.
Mhm.
And these women have, why they can't go back to sleep is part of the hot flash was very stressful to them. It triggered the fight or flight biology, at the vanguard of which is adrenaline.
Mhm.
They got wide awake from the adrenaline, and they couldn't get back to sleep until their midlife liver could dismantle the adrenaline, which, unlike a 20-year-old, it could dismantle that adrenaline really quickly. Not a 50-year-old. There's been so much liver issues that it takes them an hour or two to get rid of the adrenaline that got triggered.
Mhm.
The original event that triggered the fight or flight biology in the middle of the night was usually estrogen deficiency and is rectified by giving them estrogen, biased,
Mhm.
my favorite.
Yep.
So whether it's blood glucose that triggers it or whether it's estrogen deficiency, all I do know is there's so many women who wake up with a racing mind and night sweats or racing mind alone, they can't get back to sleep. They usually need estrogen, and progesterone isn't going to do it. And when you stop and think about it, your estrogen and progesterone and testosterone levels are at their absolute peak at the age of 20, plus or minus a couple of years, and then they're declining. And you have a midlife woman, and she's running low on estrogen and progesterone and testosterone usually too. So to try and get the job done with only one of the three major hormones, just not good biology. You want to give all three: biased, progesterone, and testosterone for most women in the perimenopause, and those three for all women in the menopause.
I have two more questions because we're coming up on time. But in regards to progesterone, where does progesterone play a part in cancer and cancer therapy? Because we hear a lot about progesterone being protective of cancer. What's your opinion on that?
Well, I take us back to my own opinion, which is not just my opinion, but what causes cancer.
Mhm.
And it's millions of events.
Yeah.
But as far as hormones play into it, estrogen stimulates, progesterone quiets. When there's a predominance of estrogen, it overstimulates breast glandular tissue. And there's an epidemic of too much estrogen. Instead of being balanced by progesterone, it's more like this: too much estrogen, estrogen dominance. That overstimulates breast glandular tissue and can lead to increased breast density because that's not a healthy breast that's constantly dense. Normal young women's breasts are dense. There's glandular tissue in there, but it can get too dense, and that is a risk factor. Moral of the story is progesterone is really important to quiet down the stimulatory effects. Back when I was growing up, they used to medically, we used to call dense breasts fibrocystic breast disease.
Yeah.
And a lot of these women got relief from treating them with progesterone to calm down those dense, overstimulated breasts. And one of the things we know is I pointed out that a woman peaked at 20, gradually decreased. That's ovarian hormones in general. Let's break them out into estrogen. Let's break them out into progesterone, estrogen, and testosterone. Let's just deal with progesterone and estrogen. They don't decline necessarily at the same rate. What the observation medically is, the progesterone declines earlier and deeper than the estrogen. So we're getting overstimulation of breasts, increased breast density as an epidemic, not as a natural phenomenon. These imbalances are not natural. And why do they occur? Usually stress. Estrogen's a wonderful stress hormone. When a woman gets stressed, that estrogen increases. And so much so when you see young women athletes training for the Olympics, a lot of those women are not menstruating. Their estrogen's not going down the female pathway. It's being recruited for the stress pathway. They've lost their ability to menstruate. It's going down the stress pathway. So back to one of your original points, the stress factor is a big deal. And it can lead to estrogen dominance and lack of balance by progesterone. And the moral of the story is if a young woman's feeling anxiety, get some over-the-counter progesterone to try it out.
We have 2 minutes, Dr. Rosensweet. I need to ask you this question because this comes up a lot, and you can give me a yes or no answer. I get asked a lot if a woman starts hormone therapy, is that it? Does she have to stay on it for life?
Well, there's two elements. This decline, as far as we know, it just takes place. And sooner or later, in men and women, it's men and women, it's not just women. Sooner or later, when you lose function, like a man loses his erection, or a woman gets vaginal dryness, or can't think clearly, sooner or later, you raise the question of should I be on hormones? Because I'm not getting them to recover. My ovaries are not recovering. My testicles are not recovering on their own, no matter what I'm doing here. So it's an individual decision. And in general, I say, yeah, start replenishing hormones for the rest of your life. My last day on my testosterone is going to be the day I can't take the cap off the bottle. This is just an oral syringe to get the right dose. Once I started it, that was it. With gratitude, with great gratitude.
So
And
the
when a
answer,
woman's on hormones and she stops it, she often gets symptomatic and wants them back. The question is, how about the younger women? The process of menopause is going to take place. You're not going to change that by starting hormones. If your life's rough and you haven't quite hit menopause, my best recommendation is download a copy of my book that you can offer free on
I have
your
I have
yeah,
one of it, yeah.
and it'll explain this in detail. But if life is getting disruptive, you'll have many things to do in your own health and spiritual growth, but support yourself with hormones. It's
So
not helpful to run hormone depleted. So it isn't so much if I start them up, am I ever going to get off of them? It's that, oh my God, at the point I need them, I want to start them. You can always drop them cold. It's not like dropping a blood pressure medicine. You just don't drop a blood pressure medicine
yeah.
if you're not handling the cause of the blood pressure. That's dangerous. It's not true with the hormones. The worst thing that's going to happen to you is your symptoms will recur, but you could stop them abruptly.
Mhm.
Hormones.
So
So you could
that's
figure out that experiment for yourself. But I recommend once you start needing the hormones, it's a good thing. You'll love it, and you'll take them for the rest of your life, like I am.
so the answer is potentially yes, but it is an individual decision when the time comes.
Yeah,
Mhm. Okay. Dr. Rosensweet, brilliant. Another great conversation. We definitely went down some rabbit holes, but thank you for your time again. Maybe be in touch in a couple of months and see if we want to have another chat, depending on if you like me or not.
I'd be deeply honored, Shemaine. It's a miracle and it's an opportunity and it's a gift to be able to adventure into some of the deeper aspects of what's going on for us health-wise.
Mhm.
And where we launched into, it's not the easiest territory to navigate in, but it's such a crucial one. So I really appreciate your interest there.
Absolutely. Well, we will chat soon. Dr. Rosensweet, thank you for your time.
Thank you, Shemaine.